Good afternoon, Thames Luther. Let's begin the warm-up session. What are the current trends in nursing?
Some of the current trends in nursing include telehealth and technology in healthcare, the use of telecommunication and information technology to provide healthcare services. In the field of education, graduate education and advanced practice are on the rise. There is a push toward encouraging nurses to pursue higher education and advanced credentials, such as master's degrees and advanced practice registered nurse roles. There is also a shift from hospital-based care to community-based care, as more patients prefer to receive care at home or in outpatient settings. Alongside, nurses are coming up with innovation and entrepreneurship. That is, nurses are opening their own healthcare businesses, developing new products or services, or working for non-traditional employers.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Your preparation time is over. Please start your OET speaking roleplay.
Hello, Mihiraa. I'm Thames, one of the nurses here. I'm here to have a discharge discussion. How are you feeling right now?
Oh, hello, nurse. Thank you. But I'm just so worried about Kevin. He's so small, and it all happened so fast. I know the doctor said he's okay, but I can't help but feel a little anxious about taking him home. Will he really be all right?
I completely understand your concern, Mihiraa. It's perfectly normal to feel that way after your child has had surgery. But I'm happy to reassure you that Kevin has been recovering really well. We've been monitoring him closely, and all his vital signs are stable. He's been tolerating fluids well, and the medical team is confident that he is ready to go home. The reason I've come to see you now is to go over his discharge plan and make sure you feel confident and prepared for caring for him at home. Before we get into the details, is there anything on your mind right now that you'd like to discuss?
Well, I suppose I'm a bit concerned about everything. What about his pain? And what can he eat? Will he be able to run around like a normal boy again? It just feels like there's so much to remember.
Thank you for sharing your concerns, Mihiraa. It's completely normal to have so many questions right now, and we'll go over each of them together. First, it's helpful to know what to expect over the next few days. Kevin may experience some mild after effects from the surgery, and that's completely normal. You might notice some mild discomfort in his abdomen and some gas pain, which can be a bit uncomfortable for him. He might also feel more tired than usual and have some slight bruising around the small incision sites, but this will all fade in time. For his pain relief, we've prescribed some medication. It's crucial to follow the dosage instructions on the bottle. You can also give him children's paracetamol, which is safe and effective, but please avoid giving him aspirin, as it is not suitable for children.
Okay, I'll remember that. No aspirin. What about his diet? He's a picky eater at the best of times. I don't want to give him something that will upset his stomach.
That's a great question, Mihiraa. We recommend starting with light, bland foods for the first day or two, things like toast, crackers, or plain rice. As he feels better, you can gradually reintroduce his normal diet. We want to see him tolerating a variety of foods before he fully gets back to his regular eating habits. In terms of physical activity, we need to be careful for a little while. While we want him to move around and not just lie in bed, it's important to avoid any strenuous play, heavy lifting, or rough activities. This is just to give his body time to heal properly. He can return to school gradually, but we'll discuss that more later on.
That makes sense. I just want him to get better as quickly as possible. What about his wounds? How do I look after those?
Taking care of his wounds is very important to prevent infection. You'll need to keep the small incision sites clean and dry. He can have a shower, but we advise patting the area dry gently with a clean towel afterward instead of rubbing it. A bath is also an option, but try to avoid soaking the area for too long. If he wants to, he can have a quick, shallow bath. Mihiraa, is there anything else you're particularly worried about, like when he can return to school or any specific foods?
I think you've covered most of it, thank you. I just hope he doesn't have a setback or something goes wrong at home.
That's a very valid concern. It's important to know what to look out for. While he's recovering, there are a few severe symptoms that would require immediate medical attention. You must seek help if he develops a high fever, severe or worsening abdominal pain, persistent vomiting, or any signs of infection at the incision sites, such as increased redness, swelling, or pus. We have also scheduled a follow-up appointment for him to be seen by the doctor in 2 weeks at the outpatient department. Do you have any other questions or concerns about anything we've discussed?
No, thank you for the explanation.
My pleasure, Mihiraa. I wish him a speedy recovery.